do the laser. That will help most of you out. His was a severe chronic case. Hi everyone, Dr. David Kulla here with Jerome, and he came to me with carpal tunnel syndrome, pretty severe case of it for how many years?
Over 2 years.
Over 2 years. A lot of pain in his wrist and palm. We've done some videos on carpal tunnel syndrome, but a lot of you don't know the best treatment for carpal tunnel syndrome. Right now, the treatment typically when you go to your medical doctor is going to be first physical therapy, a cortisone injection, which, did you have those? You didn't have those. Okay.
I wasn't offered it. They went straight to surgery.
Oh, straight, okay. So I was gonna say surgery would be next. They went right for the surgery, right? Doesn't surprise me, and it shouldn't surprise you. But like physical therapy or bracing. Bracing's another one, like a brace is gonna do something for you. I'm sorry, it's just not. But the FDA has now approved cold laser therapy for carpal tunnel syndrome. Now, I've been using lasers for over 10 years. I could tell you it works for so many other things besides carpal tunnel syndrome, but at least the FDA has approved cold laser therapy for the treatment of carpal tunnel syndrome. It's the only condition that laser is FDA approved for. And it works so quickly because the joint is thin. It's one of the thinner joints in the human body, right? So the effect is fast, okay? The only person with carpal tunnel syndrome, you can relax your arm. The only person with carpal tunnel syndrome that I have not been able to help was a woman that had it because she was pregnant. And that's another issue, and her carpal tunnel syndrome got better after she gave birth. So he rented our lasers. So we have cold laser rentals. You have to come to New York to pick them up. So for any of you watching in India, no, we don't ship them, or anywhere else, we don't ship them. But you come by, pick it up, and you can bring it back, and sometimes we allow people to ship it back with insurance. That being said, he has rented a laser for 2 weeks, has had 90% improvement so far, and we've adjusted his wrist a couple of times. So what I do first with carpal tunnel syndrome is I check the carpal tunnel region and check to see if it needs to be adjusted, because we have 2 rows of tiny little bones the size of small stones, let's say, or large pebbles for dainty people. And they act as an arc. The 2 rows of bones, as you can see, we'll put up a diagram of the little bones in the wrist, and they act as an arc. And then the carpal tunnel, the bundle of nerves runs through that, in that middle of that arc. But sometimes that arc gets flattened. It could be falling down onto your knees and putting your hands outstretched, or overuse injury, or an old shoulder or elbow injury or hand injury, okay? So there's a lot of things that can cause it, but it's typically an overuse injury. So what I'm gonna do is check his carpal tunnel region, and it is definitely flat. We need to adjust it. And you can, I don't know if you can feel it. Let me check your other wrist. His left wrist is fine. You feel the difference there?
Yes.
So we're going to adjust that, and that's going to help with some of that remaining tingling he has. Before he had pain, relax your arm, just let it go here. Before he had pain, now it's just tingling, correct?
Yes.
So at least it's not. Now I normally do some muscle tests also, which I did on his exam for the carpal tunnel. So I did not do that and show you guys that. We do the pinky to thumb and the pinky to pointing finger, and we check that and relax here. Good. Now, do you feel the difference in there? There's a little bit of a pocket, and maybe you don't notice it. I notice it because my fingers are so sensitive. So now we've opened up that carpal tunnel region, and I'm gonna do it and show you guys how we do it with an activator. Okay, so palm up, okay, and just relax here. Okay, did that hurt?
No.
2 weeks ago, that would have hurt, wouldn't it?
Probably, yeah.
Okay, now we're gonna check his elbow and make sure everything's okay with the elbow, because double crush injuries are very common. When you have an injury here, the adjacent joint, we always wanna check that. So go ahead and lay on your back, face up. We wanna fix that remaining 10% of numbness he's having. So I'm gonna open the arm up on 3, resist me. Push your elbow into my thigh and resist me. Ready? 1, 2, 3, good. Keep your hand like that, 1, 2, 3, resist, good. Now cover your thumb, 1, 2, 3, resist, good. And I'm gonna push in this time. Don't let me push in on 3. 1, 2, 3, good. And 1, 2, 3. Any pain?
No.
Neither of those.
No.
Especially those last two? Okay, let's try it again just to make sure. And on to 3. 1, 2, 3. You sure?
No pain, really.
Okay. And 1, 2, 3. Any pain?
No.
Okay. Both were strong and he didn't have pain. So his elbow is okay. Now we're going to do some laser treatment on the wrist. So put your wrist right over here. And when we laser the wrist, we really just want to get 3 areas, 4, the top, the bottom, and the sides of the wrist. And this laser is a 50 watts, so the treatments are pretty quick. Just depends on the power of your laser and how long the treatments are. So for anybody that's asking how long should the treatment be, just depends. Depends on the laser. Is it superpulsed? Is it continuous? So many different factors to consider. But that's how we treat carpal tunnel syndrome successfully, okay? We have a really high success rate because of cold laser, and also because I know how to adjust the wrist. Not all chiropractors adjust wrists. Extremity chiropractors do. If you have carpal tunnel syndrome, you certainly want to try the laser in the least. Even if you can't find a chiropractor that will adjust it, do the laser. That will help most of you out. His was a severe chronic case. Thanks for tubing in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.